All right, well, I'm going to go ahead and get started. Welcome everyone to our webinar series. This is the first session of our series, Mitigating Burnout and Maintaining Provider Satisfaction During Vaccination Rollouts. Today we're focusing in on engagement strategies to mitigate burnout during vaccination rollout. Just a few housekeeping rules. This session is being recorded and the recording will be sent via email to everyone who registered. Please use the Q&A box to ask questions. When you do that, please use the drop-down box in it to select all participants and panelists so that everybody can see your question. Also, feel free to use the chat box to share comments and thoughts. You can also chat Mariah Blake directly if you're having any technical issues, and she can support you with that. But we do welcome your comments. We welcome your thoughts in the chat. This will be a little bit different than most webinars in that we will have a little bit of an interactive time for you to share. So we welcome you to use that. And then at the end, please complete the evaluation so that we can continue to make sure that these are meaningful sessions for you. And then we can take those comments and apply them to our next session of the series. So if you are new to the STAR Center, I just wanted to introduce you to what we do. So the STAR Center is a branch of the Association of Clinicians for the Underserved to support clinical workforce recruitment and retention for health centers. We have a national cooperative agreement with the Bureau of Primary Health Care. We're one of 21 actually that have a national cooperative agreement. So we're known as National Training and Technical Assistance Partners, or NTAPs. And we provide free resources, trainings, and technical assistance for all health centers. So of the 21, we're the group that really focuses in on workforce retention and recruitment. And we're here to meet all of your needs. This series is co-hosted by 3 different organizations. So us, obviously, the STAR Center, but we're also partnering with the National Nurse-Led Care Consortium and Community Health Center, Inc. to bring you this series. And it's just a weird coincidence that all of our logos match. And this series is being sponsored by HRSA. So what can you expect for the sessions? First, we've already talked about what we're going to be covering for this one. But for our next session on April 7th, the National Nurse-Led Care Consortium will be bringing in different providers to talk about strategies to support provider satisfaction among nurses in the pandemic workplace. And April 21st, our third session, we'll have CHC Inc., or Community Health Center Inc., and the Weitzman Institute talk about evolving care team models in the context of the pandemic and strategies to assess provider satisfaction. The Community Health Center Inc., you may have noticed that they were featured in the New York Times for their vaccine rollout process and the work that they're doing. So please be sure to tune into that to hear a little bit more about what that looks like in their setting and how they're supporting their providers through all of this. So one of the things that I wanted to address before we get into our presentation is that this session, the series specifically, was really focused in on mitigating burnout. But as we were talking to providers in the field, what we were hearing is that people are already burned out. And so just looking at this one survey out of California, what they found was that half or more providers feel frustrated at their job. Over half feel overworked, over half feel burned out, and nearly 70% feel emotionally drained. So during this session, we're going to talk a little bit about how we support each other and work with providers who are already burned out. And one of the reasons why this is important is because we're seeing that a lot of healthcare workers are, one, they're becoming traumatized because of this. So they're tired, they're stressed, but they're also quitting. And so we want to be able to support them in any way that we can. We don't want folks to leave our organizations after the pandemic. There are some people who are, hanging on, one, because they're loyal to the organization and don't want to leave their organization in the midst of this pandemic, but they're tired and need time off, they need a break. Or, they're ready to go because they're so exhausted, but don't want to look for another job in the middle of high unemployment rates. So we want to make sure that we're taking care of people now and that we support and start the healing process now. And so after our guest presenter speaks, Ann Loeffler, she's going to give you a framework to be engaging and motivating your staff to be preventing burnout. But then I'm going to come back at the end of her presentation and talk a little bit about how we work together to support people who are already burned out and how we start that healing process. So with that, I'm going to hand it over to Ann Loeffler, who is a consultant and has been working with health centers for many, many years. She is an expert in her field, and we're really excited to have her. So thank you so much, Ann, for being part of this webinar today.
Thank you, Sabrina. Can you hear me okay? Okay. Well, it's an honor to be here today with each of you. I'm calling in from Boulder, Colorado, where I've worked in health centers, with health centers over the past 20 years, starting out in my health center here in Boulder, Clinica Family Health. And, you know, many of you have been in the health center movement for a long time, may recognize this quote. It's an adapted quote of, you've seen one health center, you've seen one health center. So similarly, what I'm seeing across the country is vaccine rollout is happening differently across the states and territories, and also within states. So different health centers are responding to vaccine rollouts differently. And so I think we need to be aware that even within a state that things are different. But nonetheless, you know, coming into this environment where providers are already burned out and then adding the pandemic on top of it is just kind of fueling that. But I wanted to just hear from you all and challenge you all, if you'd like, to share your face on video and chat into the chat just to get you warmed up, your name and where you are, actually not your name because that's already showing up in Zoom, but your organization and your role at your organization, just so we can kind of see who's in the room. Because really, thank you, Geraldine, yay! Everyone else, be brave, show your faces. You know, we're all in this together. And what I know about working in the health center movement for over 2 decades is we really learn from each other. I'm a consultant now, so I know that a lot of times, you know, consultants may know some things, but not what health centers know. So really, I want this to be a time where we're sharing our expertise and what we've learned. I can show you numbers and data like this. I'm not really seeing a lot of movement in the chat. So I want to invite you again to please chat in your organization name and your role there, just so I can kind of see who's showing up. Thanks, Roberta. Yay! It's so nice to see familiar faces and names coming up on the chat. So please continue to do that as we get into this interactive part of the webinar today. So this slide shows you kind of what vaccine rollout is looking at within health centers. This is data from the Bureau of Primary Health Care and their COVID-19 testing. And I want to check in with you. That last bullet, what do you all think is the #1 challenge in deploying the vaccine? What do you think health centers are saying is their #1 challenge? Go ahead and chat in your thoughts on that. Yeah, Roberta, you got it. Okay, yeah. It is definitely staffing to administer the vaccine. 46% of health centers recognize that. And of course, because the health center business model is staff, right? If you look at what your costs are, it's all staff. Your people are your product. And so if you're not taking care of your people, then you really have a less than great product. Even though you are there for such a great reason, and if you don't have the right people and in the right mindset, you know, it really does impact your work. So I want to applaud everyone for joining today and being able to have this conversation and hopefully share with each other what you're learning as we do this, building the plane while flying. So I'm curious to know what the vaccine rollout has been looking like in your health center or in your health center networks that you serve if you're a PCA or HCCN. I've seen a range of things. I've seen health centers who are just making sure their patients are getting vaccinated because that's their main priority. I've seen other health centers, you know, taking anyone who's got insurance, seeing the benefits of that, driving around different communities, trying to access the populations that may not have easy access to your health center, so going beyond your four walls. I'm seeing, let's see, in the chat, patients and staff, special populations prioritized, then communities. So different layers. So maybe not just focusing on patients and not just taking all comers, but there's a spectrum and a priority of that. So thanks for sharing that. And others, please chime in as we go through. We're seeing that some health centers are taking on a primary role in their states as really the places to get vaccinated. And in other states, we're seeing that they have more of a secondary role, and maybe the hospitals are more charged with doing vaccinations, or the public health departments are in charge of that, and health centers are in a supporting role. Some health centers are adding capacity, they're adding mobile units, or they're adding remote units, or they're staying within their existing site. So it's a variety. So my question is, you know, how are staff feeling at this point in health centers, given the variety of approaches? Are they regretting what has been taken on by their health center, or are they excited to be part of the solution? Or is it something in between? So is it, you know, does it depend on the staff person, the individual provider, if they're more population health focused, and they're all about public health and they want to do vaccinations, or you have providers who are worried about not being able to get their diabetes patients in. So, you know, you have a variety even within health centers. So I want to just recognize and acknowledge that diversity. It looks like in the chat, we're seeing a lot of a high volume of vaccinations happening, people in the middle of setting things up, but also still doing a lot of vaccinations. We're seeing it in the news too, which is great, but we're also seeing vaccine fatigue. People are it just keeps coming. And now that cases are back up, that just adds a layer of stress. I've been hearing, and I'm seeing in the chat too, that, you know, health center staff are excited to be part of the solution and able to serve patients who are so happy and so excited to get a vaccine finally, and being able to do that and getting that thank you and being featured in the news at a level that you haven't been before. All of that attention and gratitude coming toward the staff during those vaccine clinics has been really rewarding. And Tamara Fox is sharing that the nurses and MAs are actually carrying the weight of the vaccinations, not providers. So we want to make sure that we're focused on all health center staff, because even if you're not actually putting a shot in an arm, you do have a role in making sure that your health center is still running smoothly. So thank you all for continuing to weigh in on the chat in terms of how this is looking in your health centers. So I'm going to share with you a framework to think about when you're motivating staff. And it really is something it's a really simple thing, simple way to think about how you encourage and motivate staff, even when they're burned out. You know, it's really easy to tell staff, oh, you know, keep a gratitude journal, or think of, you know, what were the good things that happened today? When they're in the middle of burnout, you know, sometimes that kind of isn't necessarily, they're not going to hear it. So I'm going to share with you this framework because it applies in general, but even more than ever now that we're in the middle of a pandemic, on top of a crisis of staffing in terms of burnout and provider shortages and staff shortages, especially at that MA nurse level. So hopefully this framework is something you can carry with you and practice throughout as we kind of come to the end of this pandemic, hopefully soon, but also as we navigate this healthcare environment, which is very uncertain and complex. These three things will strengthen staff motivation, and even more than ever when they're burned out during the pandemic. These are what you would consider the building blocks of intrinsic motivation. And it's based on, I think the most contemporary person who has talked about these three building blocks is Daniel Pink. So if you Google Daniel Pink, he's got some TED Talks that are really entertaining and interesting about how this works. Some of you may have also heard of Simon Sinek. He talks about start with why, and he has this golden triangle that he talks about these three elements in a different way. But really keeping these three elements in mind and what you can do to strengthen that can really help. The other thing to think about is the flip side of that. When a staff person is feeling burnout or lack of motivation, usually you can pin it on one of these three things. So if you're trying to diagnose, why are they so burned out? What can I do? Really kind of using this framework can help you identify solutions and diagnose the problem. So autonomy, I think we all know what that means, but the definition's up here if you would like. Autonomy is being able to direct what you do. Or having a say in what you do. And I think in our health centers, autonomy is a tricky thing because, you can't always give full autonomy. You're not like a startup on the internet. You're not an organization that, people can just get their work done and work whatever hours. You've got patients coming, you've got customer service, and you've got compliance requirements. Autonomy needs to balance all of those things, but I would challenge you all to think about how you can strengthen autonomy right now in health centers, in your health center, or how you can encourage autonomy as a PCA throughout your health centers. And that can be as simple as making certain meetings optional, helping people, giving people more control over what they do, and allowing for flexibility. Allowing for checking in with individuals and seeing how they're feeling. Here's what you said. We asked you when you registered to share what strategies you feel are helping you strengthen autonomy, engaging providers in the planning and implementation of how the rollout looks, limiting work related to vaccinations if you need to. I'd love to hear other thoughts or ideas on how you might enhance autonomy in your health center, or how health centers might enhance autonomy. I think I mentioned being able to ask about preferences. Can you be more flexible in scheduling? How can you be more flexible in hours worked? Where can you strengthen the staff's abilities to make decisions on their own? Making sure that people doing what you can to build trust. So does everyone understand what each person is doing and how much autonomy is possible? Making sure you have a system to gather input and then do something with that input and then tell them how you did this. So a lot of times people will ask for input and then the staff are annoyed because they say, well, you asked me and then you didn't do anything. Or you ask staff for their input and then you make changes, but staff don't realize that you applied what they gave you, and they don't realize that you actually incorporated their input. And so they feel that maybe that they weren't heard, even though you may have applied what you learned. So I want to just say that when I work with health centers, communication and being able to make decisions or inform decisions is always the most important thing that staff share about what they're concerned about in their organization. It's always communication. And so anything you can do to strengthen that, especially right now, think about how you might improve that as well. So I'm seeing that health centers have been involved, health center managers have been involved in how the vaccines are scheduled, how many doses can the staff support. Hopefully those managers are informed by the staff's input on that. It looks like some sites take a week off vaccination, alternating every month, so they're not all vaccine all the time. So thank you all for sharing those ideas in the chat. Would love to hear more thoughts on how you can embed flexibility. So how can staff shape their roles and responsibilities and ensure that they understand this flexibility? Meaning, what are the parameters around that, but also how are you supporting their flexibility? And I'll just say of these three elements, autonomy, capability, and purpose, when we solicited input from you all in terms of your strategies, a lot of the strategies fell into capability. And I think that's a testament to our ability, and I say our, I mean our health centers, our ability to really solve problems and get the work done. And getting the work done is, mission critical. And how you get the work done and why you get the work done is also really important. And some people might argue the why you get the work done is even more important than autonomy or capability. But I want to encourage you all, we all tend to focus a lot on capability because we're doers. But I also want to just say that, when we're looking at motivating staff or keeping them motivated as we move through this really unprecedented time, that we tend to autonomy and purpose. It's not just about capability. So if you're not tending to autonomy and purpose, then you're missing a huge area where maybe staff could be strengthened in their feelings of burnout. So just throwing that in there. Would love to see other ideas on how you're strengthening autonomy as we go through these next ones as well. So capability is really about knowing what you're doing and being able to get better at it. I think sometimes you see this a different term used for this, but really this is just about being able to do your job and being able to advance your skills and get better. And what you all shared, again, lots of ideas on how you do this. Making sure that providers are doing, working at the top of their license, doing what providers can do, helping people understand ahead of time what changes are before you make the changes. And I'll add to that, this goes back to the next one, purpose, is when you make changes, really starting with why you made the change, why the change is happening is super important. Having clarity on how things are done, making sure that communication is consistent and thoughtful, and delegating responsibilities to the people who can do the work. And again, I'll go back to autonomy and say, how can staff shape that a little more and give more input on who might be doing things? More ideas on enhancing capability from you all, making sure that staff have training, making sure that you have enough people to manage the workload, making sure that they have the things, the supplies that they need to do the work, making sure that they are safe and secure, supporting them, with volunteers to do some of the maybe things that really can contribute to burnout even more, doing things that they haven't had to do that aren't very fun, like making sure people wear masks appropriately and explaining rules. That's a great job for volunteers. And then finally, encouraging and demonstrating a problem-solving mindset. So when problems arise, making sure that they feel like they can be part of the solution, that they're just not at the effect of a problem. This gives them a feeling of more autonomy as well. More ideas on how to support capability. And I'd love to see your ideas in the chat as well. What are you doing to support capability? professional and emotional support, checking in weekly and adjusting as needed. That goes back to the problem-solving mindset. Those check-ins can be really critical to making things better for staff. And then look at how your processes might be contributing to frustration. Are patients frustrated with the parking? Are staff frustrated with the parking? Little things like that that affect the provider and staff experience. We do so much to focus on patient-centered care. Can we use that framework to think about how we approach workflow and business processes as more staff-centered too? So really think about what might be contributing to frustration. Use that process of experiencing what a workday might look like for staff working in those vaccine clinics or trying to maintain the health of their current patient base. And again, making sure people are understanding what's happening, why it's happening ahead of time before things change. So this last one is, some people would argue, the most important. And I think this is one that, health centers, I'm just going to say it, maybe take for granted, because we are all here for a purpose. The health center movement grew out of the civil rights movement, and we all believe that people deserve health care when they need it. And that's why we're all here. It's kind of assumed that the purpose is already there. It's already baked in when you have a person who's taking a job, that they've got that in mind. But some staff aren't there for that purpose of the health center movement. Some staff are there to take care of their families, or both. And so really understanding what staff purposes are and honoring that can really help. So this idea of feeling like you're part of something greater than yourself, and doing things as health center leaders to make sure that you are strengthening that, you're validating that, you're acknowledging that throughout. This was probably, I think, we got the fewest ideas on this one, which doesn't surprise me, because this is the one that we kind of all take for granted. But I'll also offer that some of the most dedicated providers who are just putting their heart and soul in this work are the most vulnerable to burnout, because it means so much to them when they don't have autonomy, capability, and this purpose can't carry them all the way, just like capability can't carry them all the way. So I want you to really think about what you're doing to enhance purpose, enhance staff's feeling of purpose, how you're acknowledging why we're doing this, and not take it for granted that, oh, we all get it already. We all really benefit from reminding each other, what our purpose is. How many meetings have you been to at the NAC Policy and Issues Conference or another conference where someone gets up there and just really speaks to the purpose of the health center movement? It fills you up. So I would encourage you all to do more of that if you're not already. And there are some amazing people and icons throughout the health center network. You can probably find their videos as well online if you want to really talk about the history and the way that this health center movement has evolved and how we're really stepping up to the pandemic. So here was the idea that came through from those who registered, making sure that you provide time for staff to do their admin work and doing company appreciation gestures. And these are great. I would also offer, being able to send emails, talking to people, bringing people together ad hoc. People are busy, but hearing from leaders and hearing from people in the health center about why you're doing the work, reminding them, it really matters. So these are some ideas, other ideas about enhancing purpose. Would love to see what you have, what you all are doing to do that, to make sure that staff remain engaged with their purpose. recognizing and thanking staff, celebrating vaccine milestones. Milestones are huge when it comes to really bringing people together. You know, think about what milestones your health center has overcome and has also encountered throughout this pandemic. You know, even recognizing how long, you know, things have been shut down in your state, or recognizing how many days your clinic, you know, you're on day 90 of your vaccine clinic, or different milestones. Really getting creative. It really brings people together for that common experience and shared purpose. Making sure that, you know, you can engage the community, if, you know, even if you're limited in what you can do, because we're also inundated with the vaccine clinic work. You know, can you recruit some members of the community and say, hey, can you come up with some ideas to help strengthen our staff's you know, sense of purpose? How can you recognize? How can the community recognize our workers? And people want to contribute and help right now. And I think this is a great example. People are very grateful that you're all part of this work. And also, you know, the visibility, it really gives people pride when they're out in their communities and people say, oh, you work for this health center, I just saw them on the news. That really engenders pride. So to the extent that you all can increase the visibility of the work that the health centers are doing in your community, is really important to enhancing purpose. And then finally, you know, advocating and working with systems that improve access and support for certain patient populations. So patients who aren't necessarily easily accessible to you as a health center, making sure that you're able to see all patients and that patients are able to see you too. And that really can strengthen your sense of purpose, that you really are seeing the people that we're there for. With that, I'm going to turn it back to Sabrina.
Thank you so much, Anne. I really appreciate having a simple framework for how we can be looking at ways to engage and motivate our staff. So, and every day I think about, you know, autonomy, capability, purpose. Like, it's just 3 easy things to think about in your day-to-day interaction to help make sure that people are motivated. So right now I want to talk a little bit about how you help when your colleagues are already burned out. You saw earlier the headlines from news articles just really highlighting the extent to which people are burned out. And some of the chat coming in, it sounds like people are really excited to be part of this work, but man, they are tired. So let's talk about how we can be supporting them in this work. I want to start this with talking a little bit about this picture that you see on the right side of the screen of the water cups. One of my favorite presenters is Matt Bennett. He does a lot of training around stress and trauma, and he's got several books, some podcasts. And one of the things that he taught me early when I started working in this world of health centers is, particularly when we start talking about patients and why patients might be extremely frustrated, is, and that I think that we can also bring this to our conversations about staff right now, is that we can only carry so much stress. So if you think about a cup and each one of us having a cup, and each stressor just adds more water to that cup. So let's say we're already a little bit stressed out. We're in the middle of a pandemic. There was a lot of political turmoil. There's a lot of civil rights efforts happening. And you know, we're hearing a lot of people's, or witnessing a lot of people's beliefs and values that may not align with our own. There's a lot of stress happening where our work is different. So our cup gets fuller and fuller. At some point, it gets to where we can no longer take any more stress. And then what happens is that water starts to flow over. We don't have the capacity anymore to deal with any more stress. And that's where you see people maybe lash out. You might see people cry, feeling powerless because they don't have the space left. We see that in our patients sometimes. They come in, they might be angry and taking that out on the staff because they've been maybe working all day, then standing in line, feeling processed, and then by the time they get to you, they just don't have the room anymore. So any small thing might be triggering. Same thing with our staff. So I share that because I think it's important to practice empathy. You know, it's easy when we're feeling really stressed out to get angry at a colleague if they make a mistake, get angry if supplies aren't replenished that we need to have available to do our job. We need to practice empathy and understand that all of us are at a point where our stress cup, and I say this to my coworkers when I feel like I can't take on anymore, you know, my cup is full, you know, I'm sorry, I just can't take this on right now. So just trying to practice that empathy and understand that our cups are all full, and to create space for mistakes, knowing that when people are stressed, their thinking and communication is also impacted, and I'll talk a little bit about that. One thing that we can do that's really helpful is before you share your feelings, you know, everybody likes to vent. People want to talk about what's happening, but before you share your feelings, ask the other person if they have space and time to listen, because sometimes we want to help, but we just don't have the space to carry additional weight. You know, I think one thing that I love about our health center community is that we share certain values. We try to carry we kind of share each other's weight that we're carrying to support vulnerable populations. But at this point in time, sometimes it's a little bit harder to take on any additional weight. And so just asking people if they have the space to hear you and listen to you. And if you have space and if you have time, listen. People need to be heard. Talking is so helpful in terms of just feeling some relief. Just sharing that weight with somebody else is always very helpful. So if you have space and if you have the time, try to make that space available to somebody else. Some health centers are working closely to provide mental health workers to help carry some of that weight, to have somebody listen and be there available to help people navigate through all of this. When people are stressed, they often need reassurance. So anytime you can provide reassurance to somebody, that's always going to be helpful. And then just ask if there's anything that you can do. People are juggling and probably working at 1.5 times the pace that they're used to working. So if there's anything that you can do that's specific, offer that. I know personally, sometimes people ask if there's something that they can do. I can't. It's hard for me to identify any one specific thing because I feel like, well, you know, then I'd have to explain this, and then I don't know if they'll be able to do that, or, you know, they're a C-suite position, you know, they're not going to want to process these papers that I have to process. So if, you know, if you're seeing somebody struggling, offer something specific that you might be able to help with. If you have a clear understanding of their roles and responsibilities, then you might be able to identify something specific. I mentioned earlier that we think and communicate a little bit differently under stress. So I wanted to share some information with you that I think can help us be a little bit more empathetic to others during this time. Just knowing that when there's a lot of stress and mental noise can reduce our ability to process information by 80%. That means that we're not hearing a lot of what's happening. We're going to miss a lot of information. That's going to cause mistakes. And I say that because that's one of the reasons why we need to be passionate and forgive people, give people grace when they make mistakes, because they're only hearing 20% of the information, or only processing 20% of the information that's being provided to them under stress. We also know that when people are stressed, they typically will not give you the benefit of the doubt regarding the meaning of nonverbal cues in high stress situations. So people are going to assume. Sometimes they assume the worst. And so again, you know, let's give people the benefit of the doubt and offer grace and forgiveness and empathy whenever we immediately see something that triggers us. Let's think about the possibilities of why that might be happening. When people are stressed, they tend to remember what they heard first and last. And then the gap between perception and reality often widens. So people are going to assume the worst sometimes. And so again, we just want to make sure we give people the benefit of the doubt. So here are some things that you can do to help people when they're under stress to help with communication. Shorten your messages. So the optimum length of key messages offered in high stress situations, 27 words and 9 seconds. I mean, people are dealing with a lot. Their minds are spinning. They're processing a lot of information. So try to limit your points and try to make them very clear. The visual part of the brain becomes an active player in processing high stress information. So when you can, use visuals so that they can recall the visual information. If you're going to use a negative, try to balance that with 3 to 4 positives. So try not to focus too much on the negatives, and then avoid absolutes, like always and never. I also want to share some micro practices that you can do for yourself when you're feeling burned out. And these came from a really good article that was published very recently around burnout prevention during COVID. And the 5 different micro practices that the authors described were: 1 is to name it, to tame it, meaning if you're starting to feel some kind of way, recognize or name what it is. Is it angry? Are you angry? Are you exhausted? Are you concerned? Are you frustrated? If you can name it, then you'll have a better idea of how you might be able to tame it, what's really needed. Write down 3 things that you're grateful for several times a week. You know, when we're feeling a lot of stress, we tend to focus on the negative and focus on the things that are really getting to us, and we forget some of the things that we really value. So it's helpful to remind ourselves. And if anybody's ever attended couples therapy, you know, they say, you know, what's 3 things you really like about your partner? Like, oh, I had forgotten that I really like those things about you because you annoy me so much lately. And so you want to make sure that you remind yourself, you know, I'm here as part of a social justice effort. It is our health centers that are leading the way to make sure that people who are marginalized from mainstream systems get vaccines, and they get them in ways that they understand, that feel safe, they're in their own languages. So things that you really value about your work, remind yourself of those things. If somebody asks you something and, you know, you're feeling stressed and you just want to yell, or you just don't have the time and you want to kind of, you know, push them away, and just pause and say, I need a minute. And that's okay, you know. And I think for others, if you hear somebody pause and say, I need a minute, give them that space, because there's a lot going on and they may need a minute to bring themselves to a place where they can hear you. So take that space. Diaphragmatic breathing. So for a lot of you who are doing mindfulness, you know that if you breathe in 5 seconds all the way until you feel it in your tummy, and then breathe in through your nose, and then breathe out with your mouth 5 seconds. That's really helpful in terms of stress reduction. And it's a 10-second exercise that you can do when you are waiting, when you're washing your hands, just something to do to kind of bring you back to a space where you're feeling a little bit more calm and to take off some of that stress. And then make sure you take your breaks and go for walks. Walking does stimulate your brain. It helps you to rewind a little bit. If you don't have time, if you're in a management position or a leadership position, you find that your team doesn't have time to go for walks and take breaks, then you need to figure out how it is that you can make that time available. And then the last thing I want to talk about today is just how we're going to operationalize healing. Like I said, a lot of people are burned out to the point where they're feeling trauma, to the point where they're feeling a little bit of moral injury, maybe. As with our patients who have experienced this level of stress and trauma, there needs to be a plan for healing, or they're not going to be able to come back from that. We need to make sure that our providers have that space and time to heal so that they can come back and be their best selves. So some of the things that you might consider is adjusting your PTO policies, give extra PTO or wellness days, and require time off using a work rotation. And I think I saw in the chat that there's an organization that is doing that by requiring time off by closing their clinic for a week. But is there a way that you can do that by rotating work schedules, hiring relief staff. People need time off, they need to heal, and we need to find a way to provide that for them. Our organizations can invest in self-care and mental health resources. So consider relaxation rooms, a nice cozy chair, soft light, nice music, things that can bring people down a little bit when they're feeling like their cup is full, to give them some space. Consider purchasing for your staff guided meditation apps. I've also seen health centers that have been really creative in how they invest in self-care and mental health resources. I've seen health centers invest in virtual reality headsets that walk their providers through guided meditation or even yoga. I've seen a health center that even had a Buddhist monk come in and do guided meditation for their staff. So there's some really innovative and interesting things that you can do to support your staff, and giving them time to relax and heal throughout the day. So have these at your workplace so that they can take some time and say, you know what, I need a break. I'm going to go hit the relaxation room. I'll be back in 15 minutes. As I said earlier, make it easier to take breaks for exercise and relaxation. If they don't have the time, then maybe that's a trigger for you to assess whether or not you need to reduce their workload. Make sure your managers and leaders practice and promote self-care. We all know that people generally are going to mirror what their leadership does. People sometimes, if their leadership are running around frantically working, then they feel like they have to do the same thing as well. There's a real strong effort right now across not just the health centers, but across all workplaces, is we need to stop wearing burnout as a badge of honor, and we need to start recognizing that we need time to rest and relax and do our jobs at a pace that we're comfortable with, so that we're doing it in a quality way. So from leadership down, we need to learn how to practice and promote self-care. And then, and this is something that Anne had mentioned, make sure you build self-care conversations into your supervision check-ins. How are you taking care of yourself? Do you have the time to practice self-care? Are you taking walks? How are you feeling? You know, assess how people are taking care of themselves. Figure out how to make that easy for them to do. So if you have any questions, you know, for either Anne or myself, please put them into the chat box. I would love to hear from others. What are some other ways that you're practicing self-care, or how is your organization institutionalizing or operationalizing self-care? If you have some really neat things that you're doing, go ahead and enter those into the chat box. And while you're doing that, I just want to talk a little bit about the next session. Some of you in our registration said you really want to hear from providers and how they're managing their self-care while also doing this work. That's what our next session is going to be about. So we're going to have two clinicians who are going to be speaking from their perspective as nurses, doing this work, heavy vaccination rollout, but also trying to figure out how to manage their own self-care needs, as well as staff morale. So we want to make sure that you guys join us for that. So that's hosted by the National Nurse-Led Care Consortium. They'll be facilitating and moderating that conversation. And then the clinicians who will be our guests are coming from Stephen and Sandra Scheller, 11th Street Family Health Services at Drexel University. So I'm not seeing anything in the chat, and not seeing anything. Anne, do you have anything else that you want to mention as we close out?
Well, I'd just like to offer a suggestion, if we are ending a few minutes early, to pick one of those ideas that you shared on self-care and do it for yourself.
Yes, yes, thank you, Anne. We have 10 minutes. Please take that time to go for a walk. Take that time to do some deep breathing. Take that time to thank somebody for their work. let's take care of each other, and I hope we will see you on April 7th. Thank you so much for participating in this webinar. I hope you found it helpful, and please join us for the next one on April 7th. And don't forget to complete the evaluation form. There's a link in the chat that you can complete. Thank you so much, everybody. We appreciate you, and take care.